Let's start with high blood pressure, only because it's very common. Of course, millions and millions of Americans have high blood pressure or hypertension. And high blood pressure is from a structural component. When we think again of the analogy of a house, it's the thickening of the walls of the heart. Again, because the heart has to work harder, that muscle grows thicker and produces less area within the rooms of the heart, the chambers, to eject more blood. And it just makes the heart work harder with every beat. So that's what high blood pressure does to the structural portion of your heart. From a plumbing aspect, when we talk about the veins and arteries of your heart, high blood pressure is very detrimental to your vascular system. Because of the high blood pressure and the force that the blood is coming out of the heart, it can lead to small tears in the walls of the arteries, which then allow plaque, cholesterol, and plaque to form in the damaged areas of the arteries and the veins, leading to blockages that lead to heart attacks and strokes. So that's why, from a plumbing standpoint, from an artery and vein related aspect, high blood pressure is very dangerous for the patient. We really need to get that lowered. The remedy to fixing high blood pressure is, obviously, it's very important to monitor your blood pressure on an ongoing basis. Blood pressure changes. It can change within minutes, much less hours, versus morning to night. It's important to create a log and monitor your blood pressure if you're facing hypertension, and bring this information back to your doctor. Your diet is very important. Lower your sodium content in your diet. Lower your alcohol consumption. These things relate to increasing blood pressure. Let's see here. Exercise, of course, lowers blood pressure, as does losing weight, and of course, prescription medication if your doctor believes that's what's appropriate. High cholesterol, the LDL cholesterol, is, again, the bad cholesterol in the body. This is what leads to plaque, to blockages in the arteries that leads to heart attacks. From a plumbing perspective, again, we want to keep that LDL, the bad cholesterol, as low as possible. The lower we can get that, the less likely that you're going to have to form plaque, to form blockages in your arteries that lead to heart attack and stroke. The remedy, the solution to that is diet, eating low-fat meats, exercising to clear that bad cholesterol out of your body. Again, weight loss, and if necessary, statin therapy, pharmaceutical therapy, again, if that's what your physician prescribes for you. Let's talk for a minute about the good cholesterol, the HDL. That's the good cholesterol that actually comes in and clears away the bad cholesterol we just talked about. The higher your HDL, typically the lower your bad cholesterol is going to be, because this HDL comes in and clears the bad cholesterol out of your body. So from a plumbing perspective, again, keeping the arteries and veins clean, we want to keep that HDL as high as we can so it clears the bad cholesterol out, preventing plaque buildups, blockages, which lead to heart attack and stroke. The best way to increase HDL is simply exercise. It's directly related to physical activity. As a patient increases their physical activity, the HDL goes up. Weight loss also will help, and quitting smoking, if you're a smoker, will also increase your HDL. Being overweight, obesity, we've heard it for years. We all know the story. From a structural aspect, being overweight causes the heart to work much harder, which again thickens those walls, leading to heart failure. The electrical system has to work much faster in someone that's overweight, because it has to pump much faster, again, to get blood to a larger area of the body. And globally, being overweight or obese increases all of your risk factors and makes it much more difficult to be healthy from a cardiovascular standpoint. Again, obviously diet, exercise, counseling if needed, and pharmaceutical therapy, again, if your doctor prescribes it, as a potential solution toward being overweight. Lack of physical activity, the structure of your heart is weakened due to a lack of physical activity. Your electrical system, your heart rate can be affected due to a lack of exercise and physical activity. And from a plumbing perspective, the veins and arteries, a lack of physical activity is directly tied to the forming of plaque and blockages, again, leading to heart attack and stroke. The way to overcome is a lack of physical activity is get out and do something. You don't have to run a marathon. You can walk. You can take the stairs instead of taking the elevator. It doesn't have to be something, a triathlon is not what we're asking you to do. It's just get out there 4 to 5 times a week and do something to start strengthening your heart and warding off the other risk factors. Diabetes, of course, there's a strong correlation between patients who have diabetes and heart disease. From a structure aspect of the heart, diabetes severely weakens the heart overall. From the arteries and veins, the plumbing portion, it affects the lining of the vessels, again, allowing that plaque to form, leading to heart attack and stroke. And again, prescription medicine for diabetes, well-controlled diet, exercise, and weight loss will all help you to avoid heart disease, particularly if you're diabetic or pre-diabetic. Tobacco use, everyone knows this already. It's very detrimental and negative towards your heart and vascular system. From a structural component, it weakens the heart overall. From the electrical system of your heart, tobacco use increases your heart rate. And from plumbing, it leads to toxins being spread through your arteries and through your veins and the vessels, leading to plaque formation, heart attack, and stroke. Again, smoking cessation and prescription therapy to stop, if warranted, are successful remedies for stopping smoking and improving your health. Inflammation is one that people may not recognize as much, but we're really recognizing this more now in the cardiovascular space. Globally, this increases your risk of all heart-related problems, but all disease processes as well. And inflammation is really a major culprit toward bad health outcomes. And a remedy toward reducing inflammation and the inflammatory process is really watching your diet, particularly sugar. Sugar consumption is directly related to inflammation around your entire body, leading to these disease processes that you can see on the screen. Stress reduction, potentially pharmaceutical therapy. Family history, this increases your global risk. Family history of heart disease, this is the only non-modifiable risk factor. It's the only thing you can't change. The good news is all the rest of the things I've talked about, we have the ability to change. This one, we can't, but if we can control all of the others and know our family history, and if we have a strong family history, share this with our medical providers and use the screening tests that are out there to early diagnose our situation. Again, based on a strong family history, we improve our chances and our outcomes.